Hi, in this video we'd like to revisit the topic of adenomyosis after our previous video. Today we'd like to fully explain the condition and some of the few treatments available in today's treatment facilities and hospitals all over the world. So adenomyosis is the condition where there is presence of displaced tissue of the endometrium into the muscle wall of the uterus. Now this condition, although it doesn't sound very alarming, and it also is benign, it's not cancerous, but it can lead to the most severe form of dysmenorrhea or pain during menses. It causes the most severe form to the point where it is described like being stabbed by knives repeatedly. That's how painful these pains are described by these women who suffer from adenomyosis. Besides the already excruciating pains, it can also lead to stomach pains and also bulging in the lower abdomen. Now, why is there pressure in the lower abdomen? It's because when these tissues migrate into the myometrium, displaced into the myometrium, they also have the behavior of shedding and bleed during your every menstrual cycle in every month. So when this process takes on for a while, these lesions now they solidify, they vascularize, they become small adenomyomas, small tumor-like tissues that are also abundant within the myometrium. This can cause swelling and bulging, high pressure within the muscles wall of the uterus. So another indication of this condition is that the uterus is usually swollen and enlarged, can exert pressure on the pelvic cavity, leading to some pressure and some pains in the lower abdomen as well. So the pains are so excruciating. Not only that, it also can affect your fertility as well, leading to difficulty getting pregnant, and also if you do get pregnant, it causes recurrent miscarriages. This condition is extremely debilitating, so debilitating in fact that women are willingly going for hysterectomy. Once their doctors mention it only, they are quickly rather lose an important organ like the uterus, especially at young ages, than go through another day of having that sort of pain, because quality of life is significantly diminished, and we too can understand here at Antai Hospital. However, we do offer you an alternative to the most commonly recommended treatment, which is hysterectomy. Now, there are a few ways to actually treat this condition, and most of them are ineffective. First of all, as mentioned before, is the full or partial hysterectomy of the uterus. So because the disease originates from the uterus, it comes closely associated with your periods. Every time you get your period, the pains is extremely severe, and then it causes you to bleed a lot as well, heavy menses volume, and it gets progressively severe the more periods you get over time. And this can also lead to anemia after your period as well. So it's definitely affects your daily life and your health overall in a severe way. So many women willingly go for hysterectomy because they can no longer endure such a painful experience anymore. But they do not know that there is an alternative treatment that allows you to retain the organ and also allow you to keep your fertility. Because if you do go for this procedure, you must know that not only there are some side effects that are lifelong, you can rob you your ability to get pregnant again, so you cannot have any children of your own after you go for this treatment, which many women are still doing willingly. Secondly is that using laparoscopic technique to remove the adenomyomas, but because of lack of expertise and technique and experience, even though they go for this surgery, all of these adenomyomas are removed, they are not removed cleanly and effectively, and over 50% of the time it causes recurrence of this condition within a year. So you'll have to go for another surgery to remove it again, and recurrence happens again, so it's not very effective. Thirdly, is also another common approach, which is using pain-killing medications, pain management medications, to actually only manage the pain but does not do anything to treat the underlying condition. This is also not effective because over time your body develops tolerance towards these pain medications, and you need to up your dosage over time, and then the pain still finds a way to show itself because there's no treatment involved, no surgery at all involved in an organic disease. Organic diseases require surgery. So this is just a temporary solution. The next solution is also another rather effective method, but doesn't work for these patients, which is to get pregnant, because during pregnancy you will no longer have any periods during the entire 9 months, and then during these 9 months you won't have any pains associated with adenomyosis. Although it sounds ingenious, adenomyosis patients usually have extreme difficulty in getting pregnant. And also I'd like to mention that there are several herbal remedies and traditional medications that are still used to treat this adenomyosis that is ineffective, yet patients still willingly go for it because they do not know any other solution. Antai Hospital, however, offers you an ultra minimally invasive laparoscopic technique where we use certain medication that can actually shrink and eliminate these displaced adenomyomas within the uterus by injecting this medication directly into the adenomyomas. We use isotope tracers to actually pinpoint each of all these adenomyomas within your uterus, regardless of severity, regardless of the quantity of these adenomyomas. And once each of them have been injected with this medication, the uterus will no longer be swollen, it will retain its function and restore its normal size. Symptoms will be eliminated very quickly. This allows you to get your condition treated, and you can still get pregnant. So the main point of this video is that Antai Hospital wants you to avoid going for unnecessary hysterectomies when there is an effective treatment method, an alternative approach to it as well. Less destructive, more effective, and you can have natural pregnancies. So please get in touch with us if you are interested in such a treatment for your adenomyosis. You no longer need to go for drastic options at Antai Hospital. Please get in touch with us, with our consultants, via the website, and also leave me a comment down below.